everyone. I see folks kind of filing here to our Zoom webinar. Thank you for joining us today. It's a great pleasure to see so many of you returning back, and thank you for joining us right on time. We are in for a treat today as we have our governor joining us. So this is our COVID-19 webinar series. Thank you if you've been joining us all along in 2020, and welcome back to 2021. I'm Kristen Uhlenbrock, your host, and I work at the Institute for Science and Policy. I want to acknowledge and thank my colleagues at the Institute for putting this together, and my colleagues at the Denver Museum of Nature and Science, as well as our partners at the Colorado School of Public Health, in particular, Dean Samet. A huge thank you to him as well. So since we gathered here last in December, so much has happened in our world, both with the pandemic, with our democracy. So I do want to acknowledge a little bit of the magnitude of what's currently happening with the pandemic, and a really somber number yesterday, which was 400,000 deaths passed here in the US. And I do think there is a little bit of positive light what we'll see today, which is where we're headed as a state with our trajectory. So in our first episode of 2021, it's my great privilege to have our governor joining us today. Governor Polis has led our state during the greatest public health and policy challenge in more than a century. He's had to balance public health and safety with both our social activity and the economy, and made really tough decisions over this past year. Today, he's graciously going to give us some of his time this morning. It's also inauguration, so there's a lot going on today, another historic day in the making as well. So we're going to hear a little bit about how we're currently faring with the state and what his outlook is for the road ahead. So good morning, Governor. How are you today?
Good, Kristen. Good morning to you. Thanks for having me.
Great. We're so happy to have you. So I don't want to spend any time doing introductions because you don't need them. But I do just want to kind of cue you up, and maybe if you could just give us a few minutes overview of where we are as a state, both with our current COVID-19 cases and where we're looking with our current vaccine rollout and strategy.
Sure. Well, I want to thank the Denver Museum of Nature and Science. Thank you for doing this COVID series. In normal days, I love taking our kids there, 9 and 6, and you're really just a wonderful presence in the community. And I want to thank you. I want to thank the Colorado School of Public Health, and including Dr. Samet, the Denver Museum of Nature and Science, and the Institute for Science and Policy. I understand those are the groups that are really helping to help this occur. And I'm excited to be joining you on this important conversation. This has been a difficult pandemic for so many reasons. It's really about balancing the challenges. And obviously, you mentioned first and foremost in our minds, our condolences to all those who have suffered loss, over 400,000 Americans, over 4,500 Coloradans, and every one of them, a brother or sister, a aunt or uncle or mother or father, a friend, a loved one. I've lost 2 friends to this deadly virus, and I know that most of us have across the entire world, which really shows how we're all in this together. And at the same time, I want to show great respect for the triumph of modern science and the record short vaccination development process. Absolutely incredible. Developed in a matter of a couple months. Obviously took many more months to test and ramp up production. But here we are, less than a year in. First cases in Colorado, America, March, less than a year in, and 10 months. And we have a highly effective vaccine, 2 highly effective vaccines, hopefully a 3rd or 4th at some point soon. We are receiving, in every vaccine we get in the state, we are using right away to protect somebody age 70 and up. Why the prioritization? Why age 70 and up? Well, it turns out that when you look at the data, 78%, so just over 3/4 of our deaths in Colorado have been people age 70 and up. And it's about 40% of our hospitalizations. So we could reduce our hospitalizations by almost half, really removing the daily threat that looms over our hospital system, right? There's been times we've had to act just because our hospitals are at risk of overflowing. We haven't had those same horror stories here where they've actually exceeded capacity, but there was a time in early December where if the trajectory hadn't changed, if it had continued for a few more weeks, we would have been in a very difficult straits with regard to our hospitals. Fortunately, Coloradans stepped up, did the right thing, stopped socializing with people outside of their home, wear masks. And really people are acting because we care about our own lives, we care about the lives of our loved ones, because while this virus, as we indicated, 3/4 of the deaths are over 70, it also can strike down anybody in their prime. And we've lost people in their 20s, their 30s, their 40s. Hospitalizations, about a third of hospitalizations are people in their 20s, 30s, and 40s. It's important to protect the most vulnerable, and that will remove the strain on hospitalization, reduce deaths by 3/4. And then if there was more vaccine, as there will be, rapidly ending the pandemic and saving lives. To put things in perspective, we'll be able to vaccinate about 110, 120,000 people over age 70 this week. That's about 1 in 5 Coloradans over age 70 will get their first dose of the life-saving vaccine this week. Now, that doesn't mean that they're immune the next day, or even if any new immunity the next day. They have some increased immunity about 2 weeks after that first dose, but it's estimated to only be around 50 or 60%. So it's similar to wearing a mask. If you wear a mask and have had one dose, you have a little bit more protection. It's the second dose, about a month later, that will provide 95% protection, which is really a gold standard for the most effective vaccines out there, and truly will end the pandemic. We've now vaccinated with at least the first vaccine just under 6% of all Coloradans. So we're about 1 in 19 Coloradans have gotten at least their first vaccination, and are on the protection clock, is the way I refer to it. They're on the clock for protection. A little bit of protection in 2 weeks, a lot of protection in 6 weeks, and that number will only go up. We have been very frustrated with the erratic nature of the federal supply chain. We literally find out how many vaccines we're going to get about 3 or 4 days before we get them. Doesn't, we'll use them, but it would be a lot more cohesive to have a week or two notice and what we're going to get. We've also, as you know, gotten incorrect information a number of times. There was this whole discussion about would we release the doses that were being held back, which were the second doses to administer as the first. Well, we did that in a small scale in Colorado, but the question was, would the federal government do that, freeing up potentially about 200,000 doses in Colorado within a week? Then Secretary Azar said, yes, we're going to send them out. And then a few days later, they said, by the way, we don't have them. You're not getting any additional. Now, I hope the new incoming administration handles this competently and tracks this down. I still believe that there are doses held back there. I don't think they're held back by our own federal government, but based on the statements by Pfizer and Moderna, I believe there's additional doses that they have that are waiting instructions on where to ship. I'm confident with the Biden administration's aggressive goal of 100 million doses, 100 million people vaccinated in 100 days, that they will really scrape every quarter to administer this life-saving vaccine. We are distributing it through a variety of ways in Colorado. For most people over 70, they are a customer of a hospital. They've been in for something at some point, Centura, Kaiser, UC Health, wherever they go. Therefore, they can be notified by that hospital by telephone, by email, telephone if they don't have email, about where to get it. But we also have about a quarter of Coloradans that are not necessarily a customer of a hospital, so they're a little harder to find. That's why we work with community health clinics, regional vaccination clinics. We've done everything from vaccination clinics, 150 people age 70 and up at a predominantly Black church in Denver, to stand-up clinics in Center, Colorado, at San Luis and Alamoso, where everybody in town who's 70 and up comes by and gets vaccinated. And we're going to do more of that. But the bulk of it, the workhorses of the vaccination process, a majority are through Centura, UC Health, Kaiser, the hospitals. About 20% are through community health clinics, Salud, many others that are in communities serving the medically underserved, and about 10% through pharmacies, Safeway, your local pharmacy. So that's how it's getting out, but it's extremely constrained by the supply. Next week, while we haven't gotten the hard numbers yet, we know that's part of the problem. We'll get them Thursday or Friday. We're only expecting about 80,000 vaccines for our entire state of 5.7 million. So you can do the math. Until the supplies increase, it's going to be a frustrating few months as we see the end in sight of the pandemic, but can't quite grasp that until we rapidly accelerate the percentage of Coloradans who are effectively prevented from at least developing some major symptoms and hopefully from even acquiring this deadly virus. So It's always been a challenge to, everything is about public health, but when you think about it, the ability to pay rent and put food on the table is a public health issue. Feed your family, not be cast out onto the streets, that's a public health issue too. As is the social and emotional health of Coloradans. Humans are social animals. We're not evolved to be alone for long periods of time. And it's been very challenging to find reasonably safe ways and structured, youth sports have been occurring obviously over summer, school sports. Many kids have been back in school. The majority of school districts have been back, but some of the bigger school districts have not. And one of our big priorities is to get those school districts back. Most of them are, at least for the younger kids. And that's very important from the public health perspective. It's really, I think, the best place that the kid can be. It's a safe work environment for educators. It's one of the safer work environments, far safer than retail work environments where folks have had to go to work every day. And we've taken extraordinary steps to make it as safe as possible with layered protections for teachers and students, including mask wearing, social distancing, ventilation, symptom checking, and most recently, we announced 2 million tests a month for our schools, really to elevate our schools to the level of the Denver Broncos or Nuggets or Rockies that had that level of testing. I met with some Broncos players, went into their bubble and saw what they did. We have that ability now in our schools, locally administered, but the state is providing those 2 million tests a month free of charge to help make sure that our schools are as safe as possible. So that's some of the work we're up to, Kristen, and I'd be happy to address questions that your esteemed audience has.
Yeah, they have a lot, Governor. We never get to all of them, and they know the drill by now. We're really thankful. We'd love to see their questions. We don't get to all of them. You gave me a lot of kind of different webs and strings to kind of pull on and unpack there. I want to stick with vaccines just for a little bit, and maybe we'll move into some of that federal comments that you had. We did have a lot yesterday when I was looking through questions that were submitted in advance. Really about that kind of age group that is really at high risk, the 70 plus, and that announcement that you had made today, and I think you said yesterday about 1 in 5 by the end of this week of 70 plus year olds should be vaccinated. But what do you tell this older, higher risk population, as they're waiting, that when they're really scared? Like, what would you say to them? Some of them can't find the vaccine. They're not in line yet. Maybe they're far away. Maybe they're just scared. What would you say to them?
Well, keep up the social distancing. It's only another month or two here. I mean, even if you're, some people 70 up might have to wait 2 or 3 weeks, but it's coming very soon. Some this week, some next week, some last week. We've already vaccinated about 100,000 age 70 up. This week's another 100,000. So we'll have about 40% of everybody 70 up by the end of this week. It's just 1 in 5 this week alone. It's a bigger week than usual. Because of the real-time supply chain management that we went to. So keep up those precautions. We're almost there. I know it's tough. My kids haven't been able to see their grandparents, my parents, for 10 months. My parents got their first shot just a couple of days ago. So they're on the clock. And in a month and a half from now, we'll all be able to hang out safely together. And I know there's a lot of families looking for that. I saw in the chat that somebody got a ability to set up an appointment 60 miles away. That's difficult. It depends where they live. I mean, if you are far away from population centers, you might have to travel 40, 50, 60 miles or wait. I mean, it will be in your area at a local pharmacy or Safeway, but that's a question that you have to answer. If you have the opportunity, I think this person said at UC Health and set up an appointment, I would nab it if there's any way to get your loved one there. Understanding that's not always possible, and if you can't, it simply means you might have to wait a few more weeks till there's one that's close by. But most of the population in Colorado does live near some kind of hospital, pharmacy, or community health center. We always know that there's going to be some folks who won't, and that's why we focused on, as I said, going to some of these small towns, and it'll take us a while to get to all of them, and doing vaccine clinics. Usually working with the local fire department, local sheriff for everybody age 70 and up.
So there's public polling and research that is showing maybe upwards of a third or so of folks are hesitant or will not be getting the vaccine. So how does that factor into your planning for the long run as we try to get back to a semi-normal or whatever this new normal state of affairs is, if there is this critical number that we need to reach for some sort of herd immunity via vaccines?
Yeah, I really hope that number is lower for people over 70 and people over 60. I think it is, because people are rational and they understand the risk is much greater to them if they are in their 60s, 70s, 80s, or 90s. We're really, while our goal is 70% of people aged 70 and up vaccinated by the end of February, we hope that more people want that. But we realize it might take a little longer to get from 70 to 80% than it does to get from 60 to 70%, because you might not, you're going to be dealing with folks who are somewhat reluctant to get it. And I think would, if it's convenient, if it's easy, if they see their friends got it. But ultimately, we'd love to reach 80% plus of people over 70. For the general population, with a vaccine that's effective, I think as long as we get close to around 70%, we should be fine. Now, what does fine mean? It doesn't mean coronavirus is gone. And if you don't get vaccinated, you absolutely have a risk of getting it, probably a greater risk than you have of getting measles or mumps or other things that circulate, because this is very contagious as well. And we don't yet know. One data point we don't know is whether people who are vaccinated can transmit it, right? We know that they aren't likely to develop symptoms or get very sick. But with some diseases, this is the case, and it may be with COVID-19, is that even though you are protected, you might effectively be asymptomatic and potentially transmissible. So I think everybody, should get it at least here for the first couple of years. And I think this will become a kind of routine shot that folks get, just like measles and mumps. Now, again, not everybody gets it. That's fine. Measles and mumps occur. They're rare. And hopefully this will be relegated to that status within a year or two.
Great, thank you. You briefly brought up a little bit about the 200,000 additional doses that had been promised, didn't turn out, just wasn't there, was not the case. What has been your take in general about the federal response to date, and any hopes for this incoming administration that takes office today?
Yeah, I mean, I think there's a lot of areas to improve upon, finding where those extra vaccines are, if they're at Pfizer, if they're at Moderna. There's still, we hope, the approval of the Johnson & Johnson vaccine pending. That's a one-shot vaccine. Now, we don't yet know its level of efficacy. It might not be the full 95%, but how wonderful to have a one-shot regime instead of a two-shot regime. A couple of people asked about 65 and up. I would, again, the reason we're not able to give a date yet is we simply don't have the supply. We don't know the supply. My best guess is 2 to 3 weeks. It'll open up to 65 and up. But we have, as I said, we'll be at about 40% of the 70 and up by the end of this week. We need to be a bit higher before we open that up. We don't want to, none of us would want to take vaccine from an 82-year-old to give to a healthy 66-year-old. There's just a very different risk profile, even in those 15 or 20 years. Over 80, when you contract COVID, you have close to a 9% chance of dying. In your 60s, it's still around 1%. So, that clearly, based on the data, that's the next category. Whether that is 2 weeks from now, or 3 weeks from now, or 4 weeks from now, the reason we can't say is because we simply don't know how much vaccine we're getting from the federal government each week more than a few days in advance. I'm really hopeful that at least people can have a date and set up those appointments soon, right? So if the one thing the Biden administration can give us is a steady flow, and knowing what we're going to get when, then we could say, okay, the date is, February 15th or February 10th. And then after that, you can set up your appointment, get going, et cetera. Teachers are right after that. Well, they're in 1B, which we're in early March is the conservative date based on the supply we think we're getting. But we really hope that that's earlier if we get more. So it could be late February. That's they're the next group up after the 65 and up.
And we have talked about this in our series a few times too, and I would love your thoughts and reactions. The pandemic has really highlighted some social, economic, and racial inequities in our communities. Could you speak about some of the impacts to both the Black, Latino, Indigenous communities here in Colorado, and what resources has been made available to this group that has been disproportionately impacted?
Yeah, so the tribal nations in Colorado, the Ute Mountain Ute and the Southern Ute are working directly with the federal government and have their own prioritization and supply as the nations that they are. We've developed a vaccine equity champions group. As I indicated, we've had drive-throughs, and we're going to have more at Black churches and also in some of the poorest, lowest income zip codes in Colorado and San Luis and Costilla County, predominantly Hispanic, very low income. So we're making a concerted effort to go outside of the conventional healthcare system to help reach those who are medically underserved.
Great. We've got about just a few more minutes of your
Yeah.
time left. So I want to be
So
respectful of that. Yeah.
yeah, so somebody said, my provider doesn't have it. How do I get it? This is a great thing about this. You don't have to go to sort of your normal provider. Your network doesn't matter. Your insurance doesn't matter. It's free. It's paid for by the federal government. So look at covid19.colorado.gov. Look at list of providers, and you can sign up to get it at UC Health, even if you've never been there and it's not in your network, at Kaiser, if you've never been there and it's not in your network, at Centura, at a local community health clinic. They are notifying their customers, right? And of course, through email, through phone, if they don't have email. But they also are randomizing anybody who signs up who's not a customer. And we've made that a priority. We said you need to have a public portal to take signups because we know that not everybody is a customer. So if your provider doesn't have it, you can sign up covid19.colorado.gov, list of providers if you're over 70. And then when the time comes when you're over 65, not yet, but if you're over 70, no, somebody said that you need a provider referral. You don't. There's public portals. You can sign up. You just have to verify that you're 70 and up. covid19.colorado.gov. They click on list of providers. It doesn't mean that every branch of that hospital has it. I mean, especially some of those small ambulatory centers doesn't mean they're giving it there. You might have to drive. It just depends where they're giving it. And yes, you can sign up at 2 or 3 and then just cancel or don't respond when they give you an opportunity at 1 if you already have one. And I think if you're 70 and up and you're on this call, you will get your chance in the next 2 to 3 weeks, right? I mean, I just can't guarantee you it's this week. 1 in 5 of you will be fortunate to get it this week, next week, the week after. But and we're not yet prioritizing 80 and up. We're just doing 70 and up as a category. So it's not within that. While it'd be nice, it's just too hard to coordinate. So your chances are the same if you're 71 or 81. And chances are good. I mean, you're going to get it in the next 2 or 3 weeks. I guarantee you with the quantities we're getting, but it might not be this week. It might be next week. So
Right.
it might be the week after. So, sign up at a provider. There's a number of them. You don't have to be a customer there. It doesn't have to be a network. It's all free. If anybody tries to charge you or get your credit card over the phone, it's a scam. Do not give it. And if you get that invitation via phone or email to set up an appointment, do it. And I mean, even if it's a little inconvenient, one party said it's 60 miles away. That's not great, but it might be the question of doing that now or waiting 3 weeks to do it closer. And you may want to do it now. If you're able to stay home and avoid others, you may want to wait 3 weeks too. I mean, that's fine. So that's where we are.
Right.
If you're 70 and up, your sort of randomized number, if you're signed up, will come up in the next few weeks. You have the priority now. Hospitals, community health clinics, pharmacies, and covid19.colorado.gov. Click on list of providers and sign up on one that's near you and convenient. And you should be able to get it very soon.
Great. We'll send that information out. We do a lot of communication with our audience, so we'll make sure we have links and some directions for everyone in our follow-up, Governor, so that it's great to continue to reiterate these resources. I want you to put on your glass ball for us, pull that out and do a little forward thinking. I would love you to think about, what has been some major social, societal, systemic changes that you think is going to last here in our state once this pandemic is over.
Well, certainly more people are going to be able to telecommute than before. And we just, as a microcosm of this, use the state as an example. We have about 31,000 employees. During the height of the pandemic, we're as high as 65, 70% telecommuting. Not everybody can telecommute. If you're a prison guard, if you're clearing snow on the road, you have to go in. But we've had about 65, 70% telecommuting. What we expect to be a year from now, 2 years from now, is around 20 to 30% telecommuting. I think we can maximize productivity, employee morale, retention, and still have many people are able to do their work even better from home if they choose to. They'll certainly have a place they can come in. And many companies are making a similar equation. We're going to be reducing our square footage of state government office space by 1 million square feet, saving taxpayer money and increasing productivity by allowing more workers to work at home.
Great. Another big question, but in the regards very relevant to what we talk about often here at the Institute, which is the idea of trust, specifically trust in science. And science and politics and policy are very deeply interwoven in their relationship. We've seen that, a thousandfold here with the COVID-19 pandemic. We also do see science being politicized at times, and that can impact people's trust in it. What's your take on this? Maybe use it through the lens of COVID-19. What do you see happening? How do we work through some of this politicization of science?
Well, science is science, and the data and the science don't have an ideology. They might inform your actions, but they are simply the facts. And I was really glad to see that President-elect Biden, very soon President Biden, what time is it today, right? That's in another hour or so, has elevated a science officer to a cabinet level position, really showing the value that science will have. Science doesn't make the decisions any easier. You have to look at the trade-offs, right? There's health, there's public health as an economic and security issue, there's emotional and social health, but being informed by the data and really citing the data and science and making decisions is important, not just during a pandemic with regard to COVID, but really across every aspect of governance.
Great, thank you. Cognizant, we've just got a couple more minutes with you, so I do want to leave you maybe with a final word here, a thought. You've been our governor for 2 years now here in the state of Colorado, and it's been a really trying last year for so many, including yourself, leading us through this public health challenge. So, what has been most challenging for you for this past year since you've been the governor of our state, and what is your silver lining and outlook for the road ahead?
Well, look, I think we all are excited to move past this pandemic, which I think by summer we will largely be out of that mindset and people will be vaccinated. And it doesn't mean, again, nobody will get COVID, but certainly the most vulnerable will be vaccinated. It is a low risk disease for, teenagers and kids, even in their 20s. Like for instance, at CU, we had 1,000 or so, at least 1,000 cases, 0 hospitalizations, right? And that's not atypical for 19 and 20-year-olds. That would be very different when it goes through, let's say, a senior living facility with 80 residents, and you might lose 11 of them, and that's happened in our state. So the pandemic won't be over once we protect people over 70 and over 65, but it'll be a different phase. It'll feel different. Our hospitals will no longer be overcrowded. The deaths will still occur, but will be reduced by 3/4. So that's the sort of end of the crisis phase. The pandemic itself will be over in summer once we've reached a level of immunity among the general population where the virus again might exist. And if you're dumb enough not to get the vaccine, you might get it and you still might die. But at least if you wanted the vaccine, you'll have had the opportunity to be fully protected against it.
Right. Well, thank you very much. We're really grateful of your time this morning. It is a big day for all of us, and we're glad you're able to join us. It kicked off our 2021 series on a really high note. So we've been itching to have you, and we're so grateful that you're here. Thank you to all your staff, CDPHE and so many others in our state that's been working really hard and tirelessly to provide us with information. Thank you very much for joining us today, Governor.
Thank you, Kristen, and we look forward to, again, when it's safe and normal, we'll bring the family down and enjoy the museum. I assume you're probably open. You've been open. You kind of haven't. Yeah, I mean, we could go now. We've actually had COVID, so we're probably lower risk, but we're not quite doing those kinds of things as a family yet. A lot of folks are waiting, but we'll be looking forward to joining you all again in person. We love the museum, and we hope to see you again soon.
Great. We'd love to have you there. And yeah, we've been open. We only closed for 100 days, and we've had really safe protocols in place. And we've been really thankful for the ability to be open in a really safe way for many months after that.
And that's really the challenge we all have. That's why the schools being back, all this is so important. It's not, the answer is not to not do anything. It's to do it in a very safe way. I mean, I visited many schools in the last few months that have been fully open, and the teachers are excited, students are excited. As I said, a majority of districts have been, but it doesn't look like a school 2 years ago. You wouldn't know what you were walking into. I mean, everybody's wearing masks. The kids are 3 feet apart in the classroom. A window's open if they have it. The parents did symptom checking at home. It's remarkable, but it works, and that's what's so exciting. What you're doing works, right? I mean, it's it doesn't mean that no transmissions ever occurred, at your museum, but it's a low risk environment, just like schools are. And some people, especially in their 70s and 80s, are just not going out. And I totally get that. My parents are in that crowd. They're 76. But for most of us, it's about balancing that risk. And just like there's a risk of getting in a car accident when you're driving, to a museum or to a school, nothing is zero risk. But I think you're doing a great job with the protocols you have, and it's a reasonably safe environment for families to enjoy in this very difficult time. And of course, we all look forward to this being in the rearview window soon.
Yes, thank you. And then there's people like me who don't actually have to be working in the front with the public, and the desk jockeys, I'd like to say. And here I am, been stuck at home. And so I even miss the museum environment myself. So yes, thank you very much for joining us today, Governor. Thank you to all of our audience for tuning in. We will send you resources that the governor mentioned. We did not get to all your questions, but we're really grateful that you were able to spend a few minutes with us and the governor this morning. Just a quick reminder, we'll be back next week at Wednesday at 8:30 a.m. We will have the former CDC director, Tom Friedman, joining us next week. And he'll be talking hopefully a little bit more about our national response with the new incoming administration as well too. So kind of focused here on the state with some ties to the Fed. And next week, we'll absolutely be talking about that little bit of a bigger look at our national response. Nicole dropped in all of our handles. Definitely sign up for our mailing list to stay up to date on everything that is going on with the Institute and the series. A huge thank you for joining us today. We had to cut this a little short because it's a really busy day for the governor. We're really glad he was able to join us. Thank you all for tuning in. Please stay safe, and we look forward to seeing you here next Wednesday.